everybody, Azar again, Dr. Physical Therapy. Today we're gonna go over some leftover exercises for the scoliosis that can be helpful. We already went over the stretches for the most part, the strengthening, and now we're gonna go through some other things that can help with the people with the scoliosis. First of all, we're gonna talk about again, like I can have myself as a demo. And I just want to show you how a sliding movement can get affected by the scoliosis. So what's the sliding movement? So it's reaching sliding movement. So what we're going to do, we're going to sit or stand. You can even have a patient close to the wall or somewhere that you can measure, but you can actually visually measure too. That shouldn't be a problem. It can be happening in sitting and standing. I'm going to show you in sitting first. So what we're going to do, I'm going to have to slide to one side without my buttocks to get off the chair, okay? And then you can mark if you are in the ball is in the back of the patient, you can measure it and mark it on the wall to see how much more the middle finger goes from here to there. Maybe 5 centimeter, 10 centimeter, whatever that reaching point of the patient is in this side, okay? And then we go to the other side, make it 90 degrees, the shoulder to the body, and then we're gonna go this way and see what's the reaching point this way, okay? So I definitely have more reaching ability in this side because I feel that it can go with my curvature, but this side, when I try to go, it's stuck somewhere. And I feel that stuck in my spine, in my thoracic spine. Again, I'm gonna go over the curve. So my curve is a little towards the right, so my convexity is towards the right. We measure by the way the scoliosis by the convexity. If the convexity is towards the left, is the level scoliosis or left scoliosis. If the convexity is towards the right, then we call it dextroscoliosis or right scoliosis. Basically, I have a little bit of a right scoliosis in my thoracic spine, and I already know that. So what I'm going to show you is how with that sliding movement can help us to figure out which side our scoliosis is and how we can help mobilizing the spine to get more movement. And now I'm going this side. You see how easy it goes? Do we really need to mobilize this way more? No, because if we're going to encourage that curve to get more and more actually wider. So we want to go to the opposite side. We definitely want to go this way. And then we can mobilize the thoracic spine to improve that convexity on the right and make it more straight this way. But if we go this way, we're going to make it more convex to the right and concave to the left. So we're going basically making it worse. So very important for you to figure out which side and then you do the exercises based on that. That's the only thing that I wanted to tell you about the scoliosis, and it's not going to be a very long video today because it's just the sliding, and I wanted to show you the sliding movement. We can of course do it in a standing. Same thing, make sure somebody can hold on to the pelvis and then feet are on the floor. And then we go this side, slide to this side without that left foot get off the floor, and then we go this way without the right foot get off the floor, and you obviously can see how much more movement I have on this side. So I never have to do that sliding movement on this side. You can do the sets of 10, holding for 10 seconds, sliding 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. And then keep going for the set. Another component of the scoliosis is the neck. The neck also sometimes gets tight too, as I said, sometimes compensate, and sometimes the neck goes with the upper thoracic, and then we actually have the same curvature. In my case, my right neck is definitely tighter. My right side of the upper trap is even tighter. So what I'm gonna do, I'm gonna have to do that exercises to release, and then I have 2 tools to show you. Let me bring the tools. Okay. First tool that you're already familiar with is the Terracane. Terracane is for self-massage. If I have a scoliosis towards the right, I usually have a lot of tightness, and then how can I test it? I go this way, and I try to touch my left shoulder with the left ear, and then go to the right side. You see the difference? You definitely can see I have more movement in this one than this one. So my tightness, main tightness is in this side. So for the scoliosis patient, usually we can release that. This is my lovely favorite tool that I always use. It gives me a lot of relief. I encourage you guys to use it if you have a tight neck. Even though if you don't have scoliosis, you can use it. But also for the people with the scoliosis, which they usually one side tighter than the other side, they definitely want to use it. So if you push it like that, you can put your hands there, so you don't even have to use any hand grip, because some people with the neck problem, they have weak hand grip. So they better to just put their body weight on, and then at the same time you can stretch to the opposite side. And that's how you can release the muscle in the side that's tighter. Okay? That's my favorite one, and you can hold it up to even 1 minute. We call it trigger point relief. It also can happen with some sort of rope or whatever you can find. Again, I have a tight band, which is an elastic band, but since it's really tight, it works as a rope actually. It has a little bit of a nice elasticity at the ends, which helps me. So what I'm going to do, I'm going to put this right here. I can put it in even like that. And I can pull this shoulder down to release that upper trapezius in this side. And at the same time, if you want to make it more effective, of course, you can do that stretch to the other side at the same time and hold it. This is another way of self-releasing the upper trap, and it can be used on any patient and also can be used on the scoliosis patient. I just wanted to make sure we cover the neck part of the scoliosis also, because they usually have a tightness on the neck on one side. They can of course benefit from massaging in the right side of the neck and the side of the thoracic spine that's tighter. So one side of thoracic spine is usually tighter, so we can definitely benefit from massaging the tighter side and strengthening the weaker side. So that was it. And I think the video for the scoliosis hopefully is complete, and you got all the information that you needed to treat the patient with the scoliosis. But again, you make sure you see your physical therapist and your orthopedist before, and then they have to make sure that they determine the angle. If the angle is too much, maybe these are not enough. You have to do the bracing or no, hopefully not surgery, okay? So you have to have it in the mind that you try all of this, but you have to consult with the doctor, especially if it's a kid and growing fast and getting crooked and crooked and crooked every month or every couple of months, then that might not be enough. You might want to do something to stop that crookedness, okay? Thank you for watching and have a great day.